Assalamu alaikum, everybody, and welcome back to my channel. Today we have on Mr. Mohamed Abd-ElRahman, and he is an applied behavior technician. So today we are going to be talking about social skills in ABA and how ABA can develop social skills in children with autism, even ADHD, or children that just have social skills issues. So I'm going to ask you some questions, Mohammed, and then you can
Okay,
explain, and I might give my feedback. Okay.
okay, go
All
on.
right.
Okay,
All right.
nice.
Okay. Can you explain how ABA therapy helps in developing social skills for children with autism or social challenges?
Okay, explaining how therapy helps developing social skills for children with autism or social challenges. Um, you can say social skills are the skills used to communicate and interact with individuals. Social skills include verbal and non-verbal communication. First, we are going to a verbal communication. Some of the children faces very difficult obstacles about talking. They can talk well. They delay language. They delay some of the letters. They can talk. They can say the sound of the letter well. And the sorry, and the non-verbal communication people, they are gesturing, and they can't express what they are feeling. They can't express what they are want for
Yeah.
really. And if they can't express what they are needing, they are going in the a very inappropriate behavior, like they are biting themselves, they are biting the therapy, they are hitting their fist with their heads with their hands, like this. They are going to scream, hey, you are not understanding me, and I'm going to do an inappropriate behaviors. So that is the matter. That is the matter, and that is the thing. I am not understanding him because he is gesturing, and he is have defeats in gesture, so he can gesture about something he wants. The item he would like to hold, or he might want to drink, he might have to eat something, but he can't express, he can't even uh, can't even do that. So he is going to inappropriate behaviors. uh, Also, body language and personal appearance. Social skills include all types of communication, like we are saying that verbal communication and non-verbal communication. The communication we would like to learn them at the basic line, like mutual attention, greetings, and understanding the feeling of the other. The final point is social skills also teach basic social rules and general social and behavior expectation at home, at school, and in public. So we have to learn them, uh, this social skills at different settings. So we start with a session we are working in. We then move to another settings. We are fixing their environment. We are using it at home. We are using it with peers, parents, and different people. We are using it at grocery
Yeah.
shop, in public places.
Yeah.
That is.
Yeah. Yeah, because social skills is for the life, basically. So you have to
Correct.
learn how to socialize with every, everything or everybody. Like you said, going to the grocery store, going to a restaurant, going to the grandmother's house, all in the house. So all of this, everything, needs some type of social skills. Okay. What are some of the most common social deficits that you see in children with autism? Like, what is the
Yeah,
worst,
yeah,
most
yeah.
common social problems?
At the basic, when a specialist hears a common social defects, the first thing that came in the mind of therapy is eye contact. That's the
Mm-hmm.
basic thing. Eye contact is a very very important skill. But one of my friends called Abdullah Saidi was posting a live, and it was very very important. I recommend everyone who know Abdullah Saidi to watch this stream. He said that eye contact is not a rigged it's not a rigged skill, but it's very important. One of the autism children that have a little bit recovery from some of the tweets he faces. He says that when I'm making eye contact with another one, it's like I'm looking at the sun. You know how painful it is. It's not rigged, but it's very important. I have a student. He talking to me and keep talking to me and keep, but he's not at all looking in my eyes. He's like talking normally. He's like talking like there is nothing. There is any problem with him socially, but he's not looking in my eyes. It's a very The nervous system in our hands is a very difficult and it's very complex things that we have. We must know that they have defeats with processing their sensory problems. So they have a hyper sensory, and some of them hypo sensitive. Okay.
Yeah.
One of the defeats also delayed development of speech language skills. So the thing here is they might have delayed language. They can't talk the first word in their first year. They can't make a sentence. They can continue talking with a peer or with the one who's talking with them. There is also limited interest and or engagement with peers and caregivers. One of the most questions that parents uh, complain from their children with autism, that why my child is not responding to his name when I'm calling him. He's just not
Yeah.
interested. He just not don't want to respond. He's just maybe engaging in a sensory and sensory behaviors. Maybe he's engaging in playing with something he's interested about. There is
Mm-hmm.
many variable settings uh, he's doing. What he's doing actually in this matter and at this moment. One of the most defeats they are facing also, they misfriend friends easily. They can't know whether the one want to play with them or not. They can't recognize that I'm now angry and I don't want to play. They can't know uh, that I'm stressed now, so I don't want to play. Uh, they can't going in the play with rules. They just
Yeah.
want to play as they want.
They want their own
That
rules.
Yeah, yeah,
Okay. Yeah. about the eye contact, because I work not only with children with autism, but also children with ADHD. Now, children
Yeah.
with ADHD also avoid eye contact, but not the same way that children with autism avoid contact. Now, when I will ask the child, why don't you use eye contact? Usually, it's a matter of concentration. They concentrate better when they don't make eye contact, which I find very interesting. Now,
Yeah,
if I
nice.
look at yeah, if I look back at myself, because I also have ADHD, if I look back at myself, like when I was younger and going to school, I can say that's probably right. Because I remember my mom, always saying, "Look at me when I'm talking to you," you know, and I wouldn't make
I know that
eye
way.
contact,
By
and
the way,
then yeah, so
yeah,
then,
go ahead.
it's more of like avoiding the eye contact to be able to concentrate on what the person is saying, because the eye contact with children with ADHD, it seems to be distracting for them. So with autism, it's different. It's completely different. It's that they don't like the eye contact. It bothers them. It gives them a sensory, something sensory is there.
Yeah, we must respect that they are delaying eye contact to focus on the you can say the mission we are giving to them, the target we they are going to do.
Yeah.
That is, yeah, like when I'm calling, like I have a student called Ali. When I'm calling Ali, Ali talk to me and look at me and give me that pen.
Mm-hmm.
Ali is not looking on my eyes, but he knows that he have to or he must give me the pen. It
Yeah.
just
Yeah.
like he ignore eye contact to focus on the mission or the target I'm going
But
to give him.
yeah. Yeah. Okay. Um, how do you determine which social skills to prioritize in therapy?
Okay, social skills prioritize on therapy. The main thing here of knowing what they are actually need. That we can say it in one word: assessment. We have a
Mm-hmm.
lot of we have a lot of tools nowadays. The technology and the science being variable and being powerful. Nowadays we have VB map, Apples are big, a lot of assessment
Different
tools and
assessments. Yeah.
powerful as well. They are variable. They are very important and powerful. Beginning on conducting assessments such as Apples R or VBMap to identify the individual current skill levels and the area of need. We are here. We are here. We are assigning on the target we are going to work on.
Yeah. 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 Through
And
assessments. So, yeah, assessments is the best way. And it's the same thing. Even when we get a new child in, it doesn't matter if it's for ABA, if it's for special education, occupational therapy. What are we going to do first? Most of those kids are coming 2 or 3 days a week. So we want a certain amount of sessions to assess their needs, what we actually do, and then we devise a plan for that child, a personnel IEP, basically, a plan for that child. What targets are the most important, and we start with the targets that are most important.
also, we can gather information from caregivers, parents. Actually, parents is the very important one we need in our assessment. We
Yeah.
actually know what the parents actually want.
Yeah.
The caregivers that surrounding the child, and know the child better than us in the first time we met him. Some of the important thing about assessment is the age, what
Yeah,
he
yeah.
is, what he can
How
do
old
in
they
his
are.
age,
Yeah,
comparing with his peers on the same age. That's a very
yeah, right.
important, very
Yeah,
important to focus on.
yeah. When parents come in to us, what we do is we have an intake form. So the parents fill out a lot of relevant information, like the age, the school, the issues that they're having. But then they also fill out a questionnaire for social skills, for general skills, and for academic school skills if they're in a school. So then we can, and then the child also goes for like an observation. They do some
Observation,
play
observation is very good.
therapy. Yeah, they do some academic and do some academic tasks, some occupational therapy tasks, some small motor tasks. So by the end of the consultation, we have an idea. We have an idea of what the child actually needs.
We have the full picture about and picture and the background about the child, and also one of the most important tool in assessment is observation. You are
Yeah,
observing the child by yourself to know maybe the parents not giving you very good information, not
right,
very
exactly.
not
Yeah,
a
I
right
mean,
information. By the way, some of parents not telling you the truth about their children. So
yeah,
when you are observing the child, you see the full background and the full picture about the child.
yeah.
And here we, yeah,
Yeah, I
continue.
mean, we've had kids where the parents will come in, oh, he's normal, but he only has a speech problem, and
Yeah, yeah,
they'll keep saying he's normal, he's normal, he's normal. But then we get him
yeah.
into the observation. What's he doing? He's going around in circles. He's shaking his hand. He's doing like this. So we know that there's more going on with the child. Then you have to go in it back and explain to the parents. No, this child needs more support than only speech therapy. This is not just a speech issue. There's more issues going on here that we need to address.
It's like basically they can't accept their child
Right.
being an autistic. They are being choked at first, and then being with very variable stages, like till they accept of their child being an autistic child. So they have
Yeah.
to know him very
It's
well.
definitely, yeah. It's definitely a problem with acceptance. They don't want to
Yeah,
accept that
yeah,
their
accept,
issues,
yes.
that their child has an issue. It's definitely 100% problem with acceptance. Okay,
Yeah,
let's go to,
acceptance. Okay, okay, okay.
yeah. Okay. Um, what role does this, we just answered this, I think. What role does
Yeah.
assessment play in understanding a child's social needs?
I will make it in headlines only
Reiterate.
the next question. Okay. In baseline to identify the social skills they need, like verbal behavior, independence, and self-reliance, social interaction,
Yeah,
social
yeah.
interaction. Yeah.
Right. Um, can you describe a typical social skill training session using ABA techniques?
Okay, that's a very good question. We can say the example of describe your day. One of the most important rule as an ABA survey to know what I'm actually doing. Like the normal question that every parent asks their children, whether they are a normal one or an autistic or disabled. Uh, how was your day?
Yeah.
What did you do today? You were happy, you were sad. someone
Mm-hmm.
bothering you. How was your day? It's like a very simple question to them, and they want to hear their child. So I have to know what I'm doing actually to make a difference in the lives of this child. I have to learn him how uh, to talk about his day. I want him to talk about his feelings. I want to learn him emotions. I want to learn him on visual schedules. I want to use tact strategy. I wanted to use take turns strategy. I wanted to use take analysis strategy, identifying feelings and expressing them. One of the most important uh, one of the most important goals or target behavior we should learn them is to identify feelings and expressing them. I have I really actually have uh, a student. He was like I was playing with him like I'm crying and he's doing that and say, okay, okay, don't cry. And
Mm-hmm.
I'm removing my hand and smiling to him. So he's actually laughing laugh out of loud.
Yeah, yeah,
Actually,
yeah.
he was like like enjoying it. He was enjoying the way I was teaching him that target. So
Yeah,
we have to give them the target as the way that work with them. And every
yeah, yeah.
child is different from the other child,
Other
and
one. Yeah,
we all know that thing.
yeah,
Okay.
yeah. Every child is different, and you have to put your techniques or make your
Okay.
techniques in a way that works for that child, that's enjoyable for that child. Because if the child doesn't enjoy it, then he won't, cooperate.
He's not
Okay.
bearing that target behavior to himself. The main thing is to bear yourself to the child.
Yeah, exactly. How do you teach a child with autism to initiate interactions with peers or adults?
Nice one. Okay, first I have to teach him the feelings. So I'm doing that. Cry,
Hmm.
playing
Yeah.
rules. Uh, Instead of playing rules, expressing. Okay, and 1 minute, please.
Okay, we'll just wait for him to come back. Okay, he's
Yeah,
back.
I'm here. Playing roles that what I'm doing now, he's crying. I'm doing this, he's angry. I'm doing this,
Mm-hmm.
he's happy, he's smiling. So
Mm-hmm.
I have to learn emotions in playing roles using using technology nowadays. Like there is emotions actually on the tablet or the screens. Okay,
Mm-hmm.
uh, and it's like an audio. There is a sound with them. يعني
Mm-hmm.
like it's attached with a sound.
Oh,
Okay.
okay. All right. Yeah. One of the things that we have done before is sometimes a child has words. You won't say that he's verbal. You might say that he's semi-verbal. So, like for example, a greeting. So you say, "How are you?" I can give. I know one child that we did this with in particular, and he doesn't respond. So we tell him how to respond. Say, "I'm fine, thank you."
Yeah.
And we did this maybe 3 or 4 months or something like that. After that, whenever he would see us, he would say, "How are you?" So he learned from modeling, I guess, yeah, from
Yeah.
modeling, yeah, that okay, when he sees a person, he should say, "Hello, how are you?" And he actually started to do it. And we were like really happy that once he learned out of this, and then he learned more language, he learned more things that he should respond to. Because even we told his parents, okay, if you ask him a question and he doesn't answer, don't get upset or, ignore it.
Keep,
Yeah.
oh yeah,
Tell him,
just keep
yeah,
trying, with him.
tell him how to respond to the question. Because if he's not responding, maybe he doesn't know how to respond to the question. So
And
if,
we have also to teach them prompt and prompt feeding in this situation. If they are not responding, we have to start prompting and prompt feeding. And one of the most important here strategies here is natural environment teaching. We use the peers as items. We can use it to learn this target. Okay.
mhm,
uh, I'm playing with him in the nature environment
yeah,
teaching
mhm,
using net. Okay, we agreed about it. uh, we have to use different settings, first in the session, second in his normal
mhm,
environment. So we
yeah,
have to
yeah.
in different settings.
Yeah, role playing, I think it's a very important aspect because that's how you model something and they learn to do it themselves. Takes time. They're not going to learn the first session or second session. It may take 2 months, 3 months, 6 months, but
Yeah,
eventually you will see, a development.
it's not about the period of time we are taking, but you have to work in the right way under the
Right,
supervision of.
exactly. Yeah, yeah, 100%. Um, what strategies do you use to improve eye contact and joint attention?
Okay. One of the I said before, one of the most important skills they have, uh, they uh, they must have eye contact. It's not direct, but it's very important. So we first would use the contact relation. Like in ABA, eye contact is total based on its relation in specific social context. The goal is to help the individual to understanding when eye contact support communication. Like we are paying eye contact communication with something. We can use gradual reinforcement. We also increase the environment as a reinforcement for them. When he is making an eye contact with me, okay, there's praise, there's your top reinforcement. We are made as assessment, reinforcement assessment, preference assessment of the reinforcement. So we know what you like the most. Then
Hmm.
whenever you are making an eye contact with me, I'm going to give you your reinforcement, the item you like the most. I give you break. I give you FCT by time. Non NCR. Sorry, NCR. I'm going to give you NCR, non-contingent reinforcement for a specific time. I'm going to vary the reinforcement he need to after that to maintain and generally uh, the target behavior of the eye contact. So we have to also bearing eye contact with motivations. Like I said, uh, we are going to use it also in their natural environment teaching.
Yeah, yeah,
That
okay. How do you approach teaching nonverbal communication skills such as facial expressions or body language?
Nice. We heard talking about non-verbal communication skills. So we have to. They want something and they can't express. So to teach them like this skill, we have task chaining it from the easy one, easy step to the hard step. We could use visual aids like video, like
Cards.
picture cards, picture
Yeah.
exchange communication system. PIX is very important. Dr. Amr Mustafa told us, don't waste your client time. So he's nonverbal. What I have to what I have to do to increase his communication? Use PIX. It's very simple. It's
Yeah,
a
yeah,
very don't
yeah,
waste his time.
yeah. And AAC, AC. We use Seaboards. Seaboards is really good, and
Yeah,
to teach children that are nonverbal. But another thing I want to say on this, um, the parents also need to understand how their children communicate.
yeah,
My son was nonverbal until he was around 4 years old. And
yeah,
I understood his body language, what he was trying to communicate to me. So that is something that the parents also, they should take time to understand their child. It's not only us as therapists or specialists, that we need to help well, of course we need to help them, but we are the major influences of their child.
yeah.
The two hands, they can't clap, right? They miss each other, or one hand can't clap, right?
Yeah,
So
yeah, yeah, I know it.
yeah, so sometimes I find that parents, they want us to do everything for their child, and they
Yeah,
don't
yeah, I
think they
know.
need to do anything,
The,
but that's not the case.
that's a promote independency.
Yeah. So the parents also need to understand, like, especially in communication. My child's having a meltdown every time. My child's doing this every time. So tell me what happened before the behavior, what happened after the behavior, what was the consequences of this behavior. I don't know what happened before the behavior. You have two eyes, you need to see. You need to
Yeah,
understand your child as well.
yeah, we can actually fix that things about by making an data sheet, recording everything that child do, to know to make like a routine, a specific routine in Saturday, Monday, Tuesday, and all of days. So we have to making a specific routine for him,
Yeah.
and we can gradually change it by the way helping us.
Okay, somebody has a comment. I'm not sure what it says, so you have to read it because it's in Arabic. The only thing I can say is read is li. Okay, can you read that?
He asked us to translate it on Arabic. Our podcast. He want us to translate it in Arabic or talking sometimes in Arabic.
Okay, you can talk sometimes in Arabic, but to translate in Arabic, it takes too much time. It's like 2 hours,
Yeah.
so people won't watch it that much. That's why I usually stick to one language. Okay.
So we are going to continue it in English
Yeah.
or on
I mean, some things, if they ask for some certain things to be more clear in Arabic, it's no problem. But I don't want to translate the whole thing because it makes it very long, usually 2 hours, sometimes more. And people won't watch it. People won't, if it's that long, people don't want to want to watch it. So,
it's no
yeah,
worries. You can watch it in their free time or whenever
yeah,
it's possible to
yeah,
watch.
yeah. So, I mean, because
Uh,
actually,
can
I
can
put in the
I translate
description.
it to them?
Yeah, I put in the description that the live would be in English. That was there. That
Yeah,
it is an English broadcast.
I
Okay.
will
Uh,
translate it. I will translate it to them to know what's going on.
Okay.
أستاذ حسن، هي كانت بتقول إن اللايف مكتوب إن هو هيكون بالإنجلش إن شاء الله يعني، واللايف اكشوالي بالإنجلش. تاني حاجة فكرة إن إحنا نترجم كل حاجة بتتقال هتاخد وقت طويل جدا، ممكن أكتر من ساعتين، فده مش هيكون مناسب مع وقتها أو الوقت عامة، أو هيكون زيادة بشكل مش لطيف بس.
Yeah, we'll try to do another one with in Arabic with Ahmed translating, because usually if I'm going to do it in Arabic, Ahmed will translate for us. Okay.
Okay.
What?
One thing before the next question, as I said, we have to make a data sheet of the behaviors to know what in this time specifically he want. تمام. Okay. There is also video modeling and mirror exercises. Okay, mirror exercises is a very important thing. He is seeing himself acting, reacting to the whole thing. But you have to work in the same place, in the safe settings to protect your client or your child.
Right, right. Okay. What methods are effective in helping children understand personal space and boundaries? This is a really important question because a lot of kids do not understand personal space.
First, we have to mention again about their sensory problems. So, a lot of autism children are engaging in sensory problems. So, you have to respect their space. You have to know they have a very difficult processing sensory problems. They can't process. It's out of their hands. It just they are in one moment they are maybe they are going to engage in a very difficult inappropriate behaviors like biting themselves, biting the other, they are just want to everybody leave him alone, leave me alone. He's putting his head. They can't hear them well. The sound is very loud to them. The a very variable changes in their sensory processing. So here we have to modeling it, modeling that matter, prompting that to know to know about gradually prompting them. First, I'm going to sit with him and role play or social story about being towards some of the other peers or the other chefs. So at first, I'm going to sit with him, tell him a story, a social story about being with the peers, promoting it to know what is our going with us. You use another one to sit with us, increase it like task chain from the basic to the hard one. Okay.
Yeah, social stories is actually a very good way.
Actually, what do you think about this specific question? Because of it's a very important, and we can benefit from your experience as well.
Yeah, for us, we use social stories mostly social stories. Or sometimes we might take two kids and we will show them like this is not appropriate personal space, and this is more appropriate personal. So sometimes that we might actually put two kids together to show them personal space, but we use a lot of social stories. Social stories is really, it helps a lot. It helps them to understand. And role playing, like I just said, putting two kids together and putting making
And
an
modeling,
activity.
I could modeling it with other service are with me in the same room. We are sitting together and we are talking and tell him what is going with us to tell him
Yeah.
we are doing that. We are respecting the spaces of ours. We are sitting with them without any problems. There is nothing to fear. There's nothing that will stress you. We accepting that, we reducing the anxiety of they maybe face, things like that.
Yeah,
Okay,
yeah, right. Exactly. How do you work on developing listening skills and turn taking in conversation?
nice. That's a very good and very important to tell the child that I'm talking first and you are talking. I'm talking first and
Hmm.
you are talking. And the
Hmm.
important thing here is that I want him to talk first.
Hmm.
I want him to start talking with me,
Yeah,
start to ask.
initiate.
Yeah, initiate it. I want him to initiate it. I want him to participate it by himself by using a strategy called month. I want him to
Hmm.
start. Then that's the first thing about conversation. The conversation take turns. I have to model it. It's actually
Hmm.
the most important strategy here is take turn. I'm here talking, and I have a peer helping me, or
Hmm.
promoter with me. I'm talking first, then I have uh,
Wait.
to wait, then
Hmm.
uh, waiting him to respond, and
Right.
he is
Right.
telling what we are doing. The role play
Yeah.
is very good. Modeling is very
Yeah.
actually it's the thing
The
here.
best. Yeah. Yeah.
Yeah,
Modeling is the best way, I think, in this situation. Role
yeah.
playing and things like that, because this is the way that they'll learn more. Because this is kind of a complicated one. It's kind of hard to explain through social stories unless it's a video. But modeling, I think is the best technique
Modeling is the best
for this.
technique, and the last stage we are going to reach is waiting him to initiate the
Hmm.
conversation, to tell
Yeah.
us
Yeah.
what he want, actually to express the feelings, express what he is doing actually,
Hmm.
uh, what he want actually.
Hmm. Yeah. Exactly. Okay. Okay, that one I already asked. What are the challenges of teaching children with autism to interact in group settings?
In group settings, they are very like a lot of information to their head, like a lot of information he have to process, a lot of information he have to answer it. So once he is going to like engaging in appropriate behaviors, if he is not
Hmm.
going to process this information, because it's a very enormous variable information he is getting from group settings. So here
Hmm.
here is the thing: communication obstacles, like we mentioned that take turns in conversation.
Hmm.
They are not going to take their actual terms.
Yeah.
Anxiety and like shying in some group settings. He would like to sit by himself because he feels that he is not going to be acceptable one for the group. He
Yeah.
is going to be alone with himself. Changes rules, routines, and expectations. The expectations of his acceptance in the group settings is not
Hmm.
going well as he want. We can fix that with promoting them, telling them what to do, helping them with the play. Um,
Mm,
like we are going to give them a rule that they are cooperating with themselves, and
yeah,
in the group they are cooperating with that,
yeah,
cooperating with
yeah.
that.
Okay. How do you help children develop skills for collaborative play and teamwork activities?
Yeah, we mentioned that we have to learn them how to collaborative play or teamwork activity. We can give them a target that requires that they play together to get the target reinforcement of the target goal of them. Um, we can use the model positive social behaviors, like I'm going to do with my with peers the right way of doing the social behavior in front of them and making them a role play. They are playing the role and we are watching.
Right.
Uh, Creating a social hub and creating a social hub when using this with high function autism children, they are making a community in the Facebook and on the social media. There is encouraging communication. We are encouraging them to initiate communication with the other. We are encouraging them to continue communicate with the other, giving them their reinforcement they need, giving them the praise they need, giving them reducing the anxiety, reducing all of the obstacles that they might face. So, and the exception here, we have to talk about it. The exception here must be based on data, upon data. We wouldn't hurry up of the result. We have to work as much as it take. No worries about the period, but we have to work upon data. First, we start from the first target or the simple target to complex target or more than target.
Yeah. I mean, some of them is just generally giving them a target in play.
Yeah,
For example, if say you have I play grocery store, I want you to go and buy this and this from the grocery store, and they go out to the checkout. They have to We actually
yeah,
have a play grocery store here. So it's like they go and they can pick their items, and then they can go to the person that is playing the register, and they can exchange things and everything. So they learn play skills through these tasks when you give them a clear target of the task. I want you to go and fill up your basket with five things,
yeah,
for example.
yeah. I
You
use
know,
it.
yeah,
I actually used to the strategy with my with the children I work with. I work with a group of children, and we go to grocery. One is holding we are to
the cart.
yeah, some
Yeah.
holding it, and someone is getting the onion, someone is getting orange, someone is getting the apple, and someone
Mhm.
have the money to go to cashier.
Yeah, yeah. We do that also at the center. We take them. Actually, we did a program where one supermarket
Yeah,
allowed them to come in and work as cashiers for a couple of hours. Yeah, the
yeah,
regular cashier was with them, but they learned how to exchange money. They learned how to bag the things. So where our center is located, there's actually a supermarket next door. So
Yeah.
sometimes they take some of the older kids to the supermarket. They teach them how to shop. And then we have, I guess, an agreement with the supermarket, and they do some of this activities and letting them to actually help real customers. So it's real, it's really good because this is a way they can learn social activities, number one, and learn life skills at the same time.
Yeah, it's actually exciting, and they are together, and there's a good يعني, conception of accepting each other, collaborating. Many benefits is going towards them.
Yeah, yeah, exactly. How can you share? Oh, no. Can you share an example of a successful group-based social skills intervention?
Yeah, yes. I know one was very exciting that in Saudi Arabia they have a tradition called Majlis. You know
Okay.
Majlis?
Yeah, I know this. Yeah, yeah.
Yeah, Majlis is a very tradition here in Saudi Arabia. So I was working with a high function autism that we use by the way we use task analysis strategy. So we first tell them how to get the carpets and curtains, sorry, the curtains,
Yeah, yeah.
and doing in the floor, laying the curtains on the floor, and
Hmm.
then what they have to do when someone is going to enter the magnets. They have to stand up, greeting him in the right way, greeting him in appropriate way, greeting him like they want this one to sit with him, greeting him in the way that Saudi people using
Yeah.
the words they are using, like uh, I'm going to say it in Arabic. هلا مرحبا حياك. These words they are
Yeah.
using these words to greeting the one he is coming from outside to let him sit with them. Uh,
Yeah.
then uh, then they have to uh, their coffee, the Arabian
Hmm.
coffee. It's a
Yeah.
very tradition, and very important to know that you have to hold the cup with your right hand and hold
And
the
for
person with
for
your left hand, and you have to offer him a date to eat. Uh, a very tradition one to use with them. Actually, it's in their life, in their actual life, and I'm doing it like the parents was very pleased about it. My
hmm
boy is greeting me, is offering me a coffee, is offering me a date, and he's greeting me in the right way. What I need else? That's a very
hmm
good, and it was a very it's actually it was successful one, and I invite the parents to come to the majlis I made. So, and the feedback was very good actually. So we have to use the traditions of the environment we are living in.
Yeah. Okay.
Yes.
Yeah, actually, it's really good because this is teaching them their traditions.
Yeah.
Actually, we have the same traditions in Oman about the majlis, about serving the coffee and the dates and um, the greeting and all of that. So these things are actually very important, and
Mm.
it's a very important life skill and even communication skill.
Yeah.
Okay. Um, how do you facilitate interactions between divergent and neurotypical peers?
Okay, nice one. So At first, it's a very fixed one, and we have to move step by step. Like at first, we have to use education and awareness, like provide non-typical peers with basic knowledge about differentiations, emphasizing strengths and the unique abilities to reduce stigma and foster empathy. Okay,
Yeah.
the main thing here is to the awareness, to understand, to help each other. The main thing is to understand. Okay, the structure after that structured activities. We have to move step by step. We have to make it very fixed. We have to be aware of the things we are going to do, uh, like social skills training is a very important. We like what we are talking about previously, the majlis or the tradition habits they are using in their normal day.
Hmm.
Teach differentiate individuals specific social skills and coping mechanisms that help them navigate interaction effectively. They
Right.
could know the emotions on the faces around them, processing it, know how to act and interact well with it, how they initiate it. The final thing is to use positive reinforcement to encourage them and creating safe spaces for not
Right.
for avoiding the inappropriate behaviors that might be happen to be safe
Yeah.
in the so
Yeah. I think another thing is it needs to be some awareness for the neurotypical children,
yeah.
so that they understand more about neurodivergence kids as well. So there needs to be some awareness as well.
Yes,
Okay.
and the final thing we could know we can use family and the teacher involvement. We have to encourage them to involve with us with this matter.
Yeah, exactly. Okay. This is the last question I'm going to ask because we've already been on almost an hour and we'll come
Mm,
back for a part two, I think.
okay.
All right. Yeah. Okay. What strategies work best to help children with autism navigate conflict resolution in group settings?
Okay, it requires strategies that address their unique needs and support their development of social skills. Here are
Hmm.
some effective strategies. Teaching social skills directly. The social skills would use methods like role play or social stories to teach the child how to recognize emotion, understanding different perspective, and apply conflict resolution techniques. So they have to know we have to know about the social stories and the role playing to use it well. One of the most important thing we have to use is using the visual supports, like we mentioned before, like videos, like pictures. If he is non-verbal, of course, encourage emotional regulation, model appropriate behavior towards them,
Yeah.
provide structure opportunity for practice, and collaborate with the peers. Collaborate with the peers is reducing the anxiety and enhance the acceptance of our children.
Yeah, as you said, I think the best thing for this is that you're going to have role play, and you're going to have modeling, and you're going to have social stories. I think this is the best way you're going to try to teach conflict resolution. Okay, this lady has a comment, and I'll answer that. I wish there'll be a second part. There will be a second part because we didn't finish our goal for today. So inshallah, we'll maybe do a second part, maybe next week or the week after. So there will be a second part because we didn't finish.
Inshallah. Inshallah.
Yeah. Okay. Thank you for joining us today, Mohammed. And I will talk to you soon to organize the part 2.
Okay, I'm waiting that.
Okay. Thank you.